St. Anthony Hospice in Henderson serves families in Henderson, of course, in Henderson County, Union and Webster counties as well. Kelly Holleran is the Director of Social Services, and Kara Henshaw is a nurse practitioner. Welcome, ladies.
Thank you.
So this month is Palliative Care and Hospice Awareness Month. So, Kelly, what are the things people need to know, those important differences between palliative care and hospice?
Sure. So the big difference between palliative care and hospice is we both serve chronically ill, terminal patients, but palliative care is geared towards people who are still seeking treatments, who are still able to go to their doctor's appointments, still able to go to the hospital if needed, those kind of things, whereas hospice care is geared more towards people who are unable to do those treatments or have chosen not to do any treatments. So that's the big difference between them both. Palliative care is free to our community, so we don't bill or charge for that. And Medicare pays for hospice at 100%. So that is your right as a Medicare recipient to be able to have hospice care.
And that's an important piece to know, because I'm sure you both get asked, what is this going to cost, and what if it lasts a long time, and all those anxieties that people have. So Kara, from your nurse practitioner side, what are the difference in protocols if you're dealing with someone who's in palliative care and someone who's in hospice care?
So in palliative care, we do a lot of chronic disease management, try to coordinate with the patient's primary care physician or their specialist and make sure that their symptoms stay controlled. Whereas in hospice, we actually take them on as a patient. I have a caseload in hospice, and I'm the one in charge of doing all of their symptom management. So with palliative care, it's kind of more like chronic care management and coordination with their physicians that they already have. And so that's really the difference there.
And it's in home. Typically.
It is in home,
palliative care is in home.
Yes, both of them are in home.
But hospice is too, right?
Yes, yes.
Until you get to the facility level. So for, I know so much of what you both do is educating the loved ones. Because they have so many questions, and some we don't even know what to ask. So what are the most common things, Kelly, people ask you, family members?
A lot of people ask kind of the common misconceptions of, oh, well, what if somebody lives longer than 6 months?
Right.
Or, what if I have to go back to the doctor because I broke my leg? Well, if somebody lives longer than 6 months, as long as they still have that disease and they're still considered terminal, they can still have hospice. That's not a problem. It's just an expectancy of 6 months to a year. They've kind of changed those guidelines, but it doesn't matter. We've had patients live years on hospice, and a lot of people just have a lot of misconceptions about hospice and what it is. So those are kind of the big things. If somebody falls and hurts themselves, and it's not related to their illness, absolutely.
We're going to treat them. I would imagine that would be a question that people ask. I mean, what do I do? Well, okay, set the arm. Right. But I get that. I get that. And I know you hear it all the time, talking to family members about, when is too much intervention. I mean, there's just a lot of what you all do to help people make those decisions.
A lot of heavy conversations at times.
But important ones.
Absolutely, absolutely.
Well, thank you both for what you do.
Thank you.
Your compassionate care.
Thank you.
We'll be right back. Don't go away.